So let us begin with how asthma develops. Variations in some genes disrupt normal functioning in epithelial cells of airways, thus exaggerating immune responses, and this makes the airway overreact to a variety of stimuli present in the air we breathe. This causes inflammation and hyperresponsive airways. Now, repeat exposures of these environmental stimuli or even non-environmental stimuli causes acute attacks in these airways and lead to airway obstruction, which produces the signs and symptoms. So, as you can see, we can prevent attacks to some extent by minimizing exposure of these stimuli. Now, now house dust mites are the most common allergen involved, and these guys feed on dust, and dust is mostly our own dead skin cells. So dust accumulates even if the windows and doors are closed, and it's because of us. So I have written few important measures. Number 1, avoid carpets because they accumulate a lot of dust. Wash all bedding at least weekly because that is where we spend one third of a day. Use washable curtains and, of course, wash them regularly. Clean dust by vacuum cleaner. Reduce humid and cold air by air conditioning. Now, plant pollens and fungal spores might get inside the home from outside air. So, use air filters. Also, don't go to areas with wild plants and wild grass. Now, pet dander can be decreased by avoiding feathered or furry pets. Avoid air pollution and smog. Avoid all kind of smokes. Wear masks. Now, respiratory infections have also been implicated, so get immunizations for flu. Lastly, if you have an occupation in which there is exposure to toxic chemicals and hazardous fumes, so you may find a more suitable workplace. So I have zoomed here a bronchiole, and the inflammation that we talked about causes the circular muscle of the airway to contract and also secrete a lot of mucus. This causes narrowing of lumen and airway obstruction, which causes the following symptoms: chest tightness, cough with sputum, dyspnea, which comprises of shortness of breath, difficulty and effort in breathing out, difficulty and effort in breathing in, fatigue, and sweating. And then there are two sounds produced from these airways. Number 1, rhonchi, number 2, wheeze. Now I will explain about everything in detail in our second video. For now, let's talk about diagnosis. Now, if full-blown signs and symptoms of asthma are present, a trial of treatment is usually started. But if the clinical assessment is uncertain, a test called spirometry is done to support the diagnosis. This is a spirometer which measures the volume of maximum possible expiration after a maximum possible inspiration. The results are then displayed on a computer screen in text and graphic form. This is a volume time spirograph. This is a reference curve used for comparisons. The total volume expired is called forced vital capacity or FVC. The part of FVC expired in first second is called FEV1 or forced expiratory volume in first second. Note that these FEV1 and FVC values of reference curve vary according to age and gender as shown in this figure. Let's zoom this graph. Let's say that these are the values of patient. So you can see that FEV1 and FEV1 FVC ratio decreases. After this reading, a beta 2 agonist which relaxes the airway is given to the patient, and after 15 minutes another reading is taken. You can see that the curve comes towards the predicted reference curve. So if these two findings are present, that is FEV1 and FEV1 FVC ratio are less than 80% of predicted reference values, and there is reversibility after inhalation of beta 2 agonist, then it confirms asthma.